Pain management is a way of helping people with persistent pain. Pain management focuses on improving quality of life rather than targeting pain. Because the more people improve their quality of life, the more they find their pain shrinks. When people develop persistent pain, they often get caught up trying to fight it. Unfortunately, this causes more problems as it tunes up the nervous system, which can trigger more symptoms and cause more suffering.
Pain is multifactorial. This means there are many different things which cause and affect it. One aspect of pain can trigger others, which can in turn re-trigger the cause. This vicious cycle can sensitize the nervous system, which can then tune up the pain experience.
So, if battling with pain doesn't help to soothe it, a different approach is needed. Pain management can help people learn to live with their pain. It supports them in making positive changes to the areas of their life they can affect, and helps them let go of others that, at the time, they can't.
This process takes commitment, perseverance, and motivation, but the rewards make it worth the effort. A better quality of life through a better relationship with your pain.
Pain management starts by looking at which strategies are working for you and which are no longer helping. It also helps you to identify anything that is making things worse. Pain management methods are based on pain science. People with persistent pain can spend a great deal of time thinking and developing negative emotions about the past.
They might also begin to worry about the future. Negative feelings like guilt, sadness, shame, and anxiety can be translated by the brain into signals that tune up the nervous system. This amplifies pain signals, which trigger further symptoms and suffering, tuning the pain volume up.
Pain management strategies help people to manage these negative emotional triggers. Instead of focusing on things they cannot do, people turn their attention towards valued things that they can do in the present. People are encouraged to set goals and reconnect with activities they value in pursuit of a meaningful life. Meditation and mindfulness are methods that can help this process.
Just like emotions, thoughts can also contribute to the pain response. A lot of people know how to rest their body, but find it much more difficult to relax their mind. This mental activity uses up a huge amount of energy and can lead to exhaustion. It also amplifies nervous signals, which leads to more pain.
It is essential that patients learn strategies to slow down their mental activity. Again, meditation and mindfulness can be very effective. Thought diffusion is also a useful skill to help achieve a peaceful mind.
Pacing is one of the most important pain management strategies. People with persistent pain often end up doing too much on their better days pushing themselves to feel better by completing a task. But the cost is often exhaustion, which is then followed by a period of inactivity. Unfortunately, this pattern of overactivity, exhaustion, and inactivity becomes a habit for many people. Over time, this increases the sensitivity of the nervous system. This may cause the pain to spread or new symptoms to develop, including fatigue and other physical problems.
Using pacing helps patients gradually raise their level of activity. This helps them to build a responsive and manageable lifestyle based around their needs and values. Some lifestyle factors can have an impact on a person's pain. Maintaining a healthy diet and staying hydrated helps the body to function well. This will allow your nervous system to tune down. Reducing how much caffeine you drink and addressing issues with alcohol and smoking is very important. Smoking has a very strong link with persistent pain, but let's remember, one thing at a time.
Sleep is another important factor that can help to regulate pain. Simple, evidence-based strategies, such as keeping a sleep diary, can help improve a person's sleep pattern. Better sleep helps people to tune their pain experience down.
Pain management helps people to understand their pain. It encourages them to take an active role in minimising its effects through positive activity and a healthy lifestyle. What produces pain? Pain is produced by the brain in response to actual or potential tissue damage or threat. Pain happens when sensors in our skin, joints, muscles, or nerves send out alert signals. This information is sent through the nerves, up the spinal cord, and into the brain.
The information is reviewed and the brain asks, "What does this mean? Is there a threat?" This activity happens without our awareness and is beyond our control. The brain then filters and prioritizes the information as it works out how much pain will be experienced. However, as it does, it also takes other information into account. Factors such as past experience, memory, and the social environment are also used to determine how severe the pain or alarm will be.
Pain is an output of this multi-stage process and is then experienced in the body's structures. Some people have ongoing pain. Others find their pain resolves. Short-term pain refers to pain of less than 3 months duration. Persistent pain refers to pain of more than 3 months duration.
Short-term pain. Short-term pain usually resolves within 3 months. It's often the result of an actual or potential damage or injury. The pain is predictable in its nature, and it responds to medical treatment. It is unpleasant but useful as it facilitates and promotes healing. And as the body tissues heal, it reduces in intensity.
Long-term pain, on the other hand, persists for more than 3 months. It isn't helped so much by medical treatments. It's variable and unpredictable. It isn't associated with ongoing damage or harm. It's an unhelpful pain, as healing has finished, but the pain persists. And it's unpleasant and has a negative impact on a person's life. Before we go on, let's be clear. Just because you may not have a clear diagnosis for your pain does not mean that you don't have pain. Your pain is real, and your experience of pain is real.
So why does pain sometimes last beyond the normal body healing time of 3 to 6 months? To understand this, you need to know a little bit about the way pain is generated. Our nervous system needs to register a certain level of information from the sensors in our tissue before it will fire a warning signal. This measured response also happens when the information reaches the spinal cord. This threshold, or the amount of information that it takes for a pain response to occur, can be thought of as a level of sensitivity.
Changes in the nervous system can play a significant role in a person's pain experience. For example, if the nervous system begins to make more sensors, the threshold and the pain response will be reached more quickly. This makes feeling pain more likely and can lead to persistent pain. On top of that, the increase in sensors makes the nervous system more sensitive, so it feels like the problem is getting worse. The pain spreads, and things that didn't used to hurt now do, such as small movements, touch, and cold. Other factors, such as stress, anxiety, and increased muscle tension, can also increase the level of sensitivity. All these things can contribute to persistent pain and can form a vicious cycle.
Persistent pain lasts more than 3 months, and it occurs due to changes in the nervous system, in receptors, the peripheral nerves, and in the brain. The nervous system becomes more sensitive, and it takes less input to activate it, which results in an increased volume of the pain experience.
Pain has an impact on a person's whole life, including family, friends, and work. Things such as low mood, anxiety, underactivity, overactivity, and poor self-care can increase the sensitivity of the nervous system.
This increase tunes the pain volume up. The good news is that it works the other way around. Good self-management strategies can reduce the sensitivity of the nervous system, tuning the pain volume down.
Medication may be helpful for some people by reducing their pain. It is usually used alongside other strategies that can help to improve quality of life. Persistent pain covers a broad range of pain, and so there are lots of different medications that can be prescribed. Understanding your prescription, as well as some basic principles, will help you to get the most from your medication. Understanding your condition and why you have been prescribed certain medication is also important. It makes it easier for you to assess the effects of the medication on your pain. It also allows you to clearly monitor any side effects you might have. In many cases, people with persistent pain may be required to take more than one type of medication.
Understanding how to take your medication means you are more likely to get the most from it. Before taking any new medication, ask your healthcare professional the name of the medication and why the medication is being prescribed for you. Ask them what you should expect from the medication. For example, will it help all types of pain, or will it just help certain types of pain, like nerve pain? Ask how much of the medication you should take and when you should take it. And ask how long you should take the medication for.
As with all medications, there are potential side effects. It is important to discuss this with your healthcare professional. But until you start taking the medication, you won't know if you will experience any side effects or not. Deciding what an effective result from medication is depends on a patient's individual circumstances. To judge whether medication is effective, it can be helpful to consider what your expectations are. Effective can mean the medication reduces pain to a certain level, whilst minimising unwanted side effects. If it is not doing this, then you need to know how to reduce, or possibly stop, the medication.
Medication doesn't work for everyone. If the medication isn't helping your pain to the level you would expect it to, then make sure you are taking it properly. Check that you are taking it at the correct dose and at the correct time.
Managing persistent pain means continually assessing the effectiveness of medicine over long timescales. It also involves setting realistic expectations. It is important to understand what the expected outcomes of your medication are. This helps you to work out whether it is effective for you within a certain time frame. Medications may be expected to work straight away. Others will take a few days, or even a few weeks, to build up to a level that can help reduce your pain.
Sometimes, when someone has had pain for a long period of time and taken lots of medications, it can be difficult to assess the true effects of their medication. When this happens, it is important to know where to go for advice. This advice can be provided by general practitioners, healthcare professionals in the persistent pain service, and also from pharmacists.
To try and get the best out of our medication, it is important to take it as prescribed. If this is not possible, you need to talk to your healthcare professional about other ways of taking the medication or possible alternative medications. Pain is easier to manage if it is tackled before it becomes too severe. So when a person has persistent pain, it is often necessary for them to take medication on a regular basis. But which medication and how often they should take it will vary from person to person. Some people are advised to take medications regularly, and some are advised to only take it if and when it is necessary. However, the important factor here is its effects on your pain and your ability to tolerate it.
Some of the top tips for using medications are: always know why you are taking your medication. Find out what the possible side effects are. Always take your medication as prescribed. Don't wait until your pain is severe before taking your medication. Often pain is better managed by taking regular prescribed medication.
If medications don't help your pain after an agreed time, discuss this with your healthcare professional. They may need to help you to reduce or possibly discontinue the medication. It's also worth noting that good diet and hydration play an important part in helping medications to work.
Remember, meds. M is for make sure you understand. E is for expected effects and side effects. D is for dose. S is for stopping.
Many people have heard about injections for pain and the fast-acting and localised benefits they can have. Injections can be effective at reducing inflammation. They can also be used to temporarily switch off nerves in a localised area. This method allows the reduction of pain to continue when anaesthetic drugs wear off.
Injections can work well for pain that is felt in a localised area, but they are less effective for pain felt across lots of sites. The injection is usually a day case procedure. They often inject a mixture of local anaesthetic and steroid. Different types of injections target different areas of pain. The peripheral nerves, tender muscle areas, areas of the spine in which the pain may be felt. If a very precise injection is necessary, an X-ray machine or ultrasound machine may be used. Serious side effects are rare, but in some cases injections can make pain worse for a short time.
Although injections can be repeated, there is often a limit to how many you can have each year. It is important to discuss other strategies with a healthcare professional. Some people may be suitable for other treatments. Radio frequency energy or electricity may be used to stop nerves conducting pain signals. It's important to remember that interventions are not a cure. However, if pain is reduced, an increase in activity may be an option, and it helps people to consider strategies for managing the pain, as we mentioned earlier. Living with persistent pain can be both physically and emotionally stressful. Not only that, the effects of long-term tension of this kind can aggravate your condition and increase your pain.
Relaxation helps to calm the body and mind. There are a number of relaxation therapies available to help with pain management. Purposeful relaxation, planned into your regular activity, can help break the pain cycle by relaxing tense muscles, reducing anxiety, lowering heart rate, lowering blood pressure, and giving you a sense of well-being.
Some people use TENS equipment to help their pain. TENS stands for Transcutaneous Electrical Nerve Stimulation. TENS uses small, safe, electrical pulses to mask the sensation of pain. It is not a cure for pain, but to recognise an effective method of pain relief. The pulses are generated by a small, lightweight unit that is powered by a battery. They are transmitted via leads to electrodes, which are placed on the skin across the area the pain is felt. The pulses stimulate the nerves on your skin and may be felt as a tingling sensation. The stimulation produces signals, which are carried to the brain, creating an alternative sensation to pain and triggering the release of endorphins. The combined effect is a reduction in pain.
The advantages of using TENS are: it's safe and easy to use. It's controlled by you. It can be used with activity and at rest. It should be used for a minimum of 3-hour periods and up to 24 hours per day. TENS should not be used whilst driving, in water, or with pads placed on infected or broken skin. If you have a heart condition or are pregnant, you must seek medical advice from your healthcare professional before using TENS.
In some cases, neuromodulation, a treatment that also uses electricity, can be prescribed to reduce pain. Neuromodulation works by implanting an electrode into the spine or near to nerves that are contributing to pain. Electricity is generated by a small unit and is passed down a wire through the electrode and directly into the site. To start with, the treatment is tested by the patient over a set period. Then, an assessment is made by reviewing its effect on the pain and the person's quality of life. If successful, the electrode will then be permanently implanted, along with a small internal control unit and battery. This allows the person to use a remote control to change certain settings on the implanted device to suit their individual needs.
This process requires careful assessment and several visits to the implanting centre. People are usually considered for this after other, less invasive methods have been tried. Another alternative therapy is acupuncture. This treatment can be effective for pain management in a wide range of painful conditions. It can relieve symptoms of pain and can have beneficial effects to symptoms such as back and neck pain, headache, muscle strain, and some rheumatic and arthritic pains. Acupuncture works by stimulating some of the body's own pain-relieving and repair mechanisms. These mechanisms differ from person to person. This means that people's response to the treatment can vary substantially.
By stimulating the nerves in the skin, the muscles, and other tissues, the process stimulates the release of the body's natural painkillers. These are endorphins and serotonin. These are released into the spinal cord and the brain and can change the pain experience.